Hello, welcome to this channel. My name is Dr. Wanjira, and this is Chic Healthcare with me, your Chic Doc. And today I would like to talk about a topic that's very close to my heart. It's the cornerstone of health, your health. It's the future of healthcare. It's the best way to approach your health. And I'll be talking about proactive healthcare. So this year, I had my first annual checkup done. I've gone to hospitals a couple of times, but it has all been a reactive kind of health-seeking behavior. So I get sick, I have a headache, I go to the hospital, get some blood works done, and then I go back, get some drugs. But this time around, I purposefully went for a checkup. I was not symptomatic. So I went into the doctor, I got my health records, got my history taken, I had my examination done, and then I had some battery of tests done. And it was a very vulnerable, to say, journey for me, because for the longest, that was the first time I actually had been, for the longest time I'd been on the other side. I'm not a doctor now, I'm a patient. That's one. And then two, I'm not really sick. So I'm just here for a checkup. What if they actually find something, which is not uncommon. And I think that's one of the fears that people have, because people say you'll find what you're looking for. Utapata to what you're looking for. And I think that's one of the fears that we need to overcome as we are walking this proactive health journey. So a good analogy is we all have something that we really care about. A shoe, an apartment, a car, just something or someone that we really treasure. And you do give it time. Let's use a car, for example. You own a car, you take it to the mechanic, you take it for the annual checks, you pay insurance for it. Once it makes a small sound, you take it to the mechanic, because if you don't, in 2 months' time, you'll go and the mechanic will be like, if you had come 2 months ago, we would not have this big issue. So now we have to kind of use such a big amount of money to fix it, or we need to replace a part or something like that. And if you think of our bodies literally take care of us our whole lives. Like, they are functioning automatically most of the time until they get to a point they just give up, And the good thing about we humans, we can tolerate a lot. Our bodies can persevere. Our bodies can take a lot of stress. So most of the time, by the time you're getting that chronic pain, or by the time you come in and you're told you have a diagnosis of maybe cancer or diabetes, it's probably been, most of the time there have been some signs here and there that there is an issue, but you're ignoring your health journey or pushing at the back of your mind doesn't make it easier, doesn't make it cheaper, doesn't make it go away. And I've seen so many cases, sad, most of them, of young people who come in maybe with a diagnosis of overt diabetes, a stroke, hypertension, and all these are illnesses that have a high potential of being prevented, very high potential. And these are people who've never had a checkup before, don't know the importance of a checkup, or even if they do, maybe there are all those factors that have prevented them from having a checkup done. So in conclusion, you having a proactive health journey would mean that you got your baseline, medical examination, history taken, and lab works, and then have a consistent follow-up over years, over time. That if you have a genetic predisposition to a certain illness, you are on proper follow-up for that as well. It also means you seeking out actively a healthy lifestyle by trying to have a balanced diet most of the time, because life happens. So most of the time, if you can do most of the time, have a balanced diet most of the time. Try and have an active lifestyle. Do your exercises, at least a minimum of maybe 20 minutes daily, as much as physical activity as you can. seeking out environments that promote your emotional wellness, your mental health, trying to, just actively seeking out a healthy lifestyle. So that is what a proactive health journey would look for you. Glad I got to do this episode. Please give me some feedback on the comments below. Subscribe as well. See you in the next one. So cheers to your health. Bye.